Well, President Cyril Ramaphosa says that South Africa is ready for what lies ahead in the battle against Covid-19. The country is in a better place now than it was a year ago due to increased vaccination, immunity levels, as well as low infection and death rates. That sparked questions about the logic behind some of the remaining Covid-19 regulations, such as the wearing of masks indoors. We can discuss the issue now with Dr. Lisa Tetteh, a medical expert joining us from Accra, Ghana. Doctor, very good evening, afternoon. Always good to have you on Newzroom Afrika. So what is your take on the regulations that South Africa still has in place to deal with COVID?
Thank you very much for having me. Well, I must say that when I read the restrictions, I was concerned especially about the mask, not wearing the mask outside. Some of the restrictions still gave an indication that, well, there were limitations, but they have been relaxed a bit. Some of them being, if there were 100 people, now it can be increased to 200 people in a particular place. And before you enter a public place, you should show your vaccination card, or you should make sure that you are vaccinated. But with the wearing of the mask only inside, and then not wearing them outside in public places, that's what raised some concerns for me.
Well, some of the other health experts in this country are saying that we don't even need to be still forcing people to wear masks because many South Africans have either had COVID or been vaccinated, so there's sufficient immunity to avoid the worst. They're also pointing to the low infection and death rates. Is that an accurate way of assessing how we should move forward on the issue of masks specifically?
So you see that currently now in most countries, the number of COVID cases that we have or are having has come to a halt, so they're reducing. So yes, it gives an indication that truly there is a reduction, but we need to be careful when we're making such blanket statements about people, about getting to levels where we think everybody is safe, or we've gotten to a level where immunity is strong, because there's still a number of people, a percentage of people that haven't been vaccinated. I believe that your president said that they vaccinated about 65%, especially of the older generation. But when we make these comments and discussions, we forget that they are immunocompromised people. They are people who are living with HIV, cancer, or comorbidities like hypertensive and diabetics, who may not fall into this category and who are at a higher risk of still transmitting the disease. And so if even one person gets the infection, there's a high risk of spread to others. So in as much as we are easing the restrictions, I would have loved that we would have waited for the body, the World Health Organization, to give us a blanket statement that, okay, at this level, we think that we should ease the restrictions, or there should be no restrictions at all.
You mentioned vaccination rates. Indeed, the older segments of this country's population have taken up these shots. The president flagged a concern about young people in this country, the youth, 18 to 35-year-olds. Only 35% have actually been vaccinated. Is there a danger in that in the long term?
Of course, there's a danger, because remember, one person can spread it to a whole country. You remember when there was Ebola in 2020, that even the World Health Organization came out to say, okay, now there's no Ebola. And then it flared up again. And then in 2021, December, they had to come up and then redeclare that then there's no Ebola. So with the way the virus is and with the way pandemics are, even one person could spread it to everyone. So I would have been more comfortable if we said that the above 60-year-olds or the older population, we have like 65%. And then in the younger population, we still had about 65%. That way we can confidently say that there is herd immunity. But if there's a very low percentage in the young population, that's been 18 to 35, then the risk of spread is still there. And now the onus lies on the government to try and encourage these people to get vaccinated. But as to whether or not they'll be vaccinated, that's also another issue.
And in South Africa, when we saw the highest level of COVID-19 vaccine uptake, there was still an incredible amount of infections. More people were dying at the time. Do you think that we're at a point where the government simply has to accept that the population will only rush to vaccination sites when the situation with COVID appears more grim at a moment, at a time?
Yeah, so you see, the disadvantage of this is that people are going to relax. They're going to believe that, oh, okay, if the government has asked us to stop, has eased restrictions and has asked us to stop wearing masks in public places, then maybe COVID is no longer there. Already in Africa, people believe that COVID is not even there, even when they see people dying. And so that's the disadvantage of that. But like I always say, when governments are making decisions, they're not just looking at the health implications, they're looking at the economic and the social implications of things. And that's why sometimes when they come up with certain measures, we are tempted to think that they are not the best measures, but then they look at everything in totality. That's why I don't have a problem so much with the easing of the restrictions. I would have wished that things like masks would have still been enforced till you were sure that you were okay, completely out of it, also you were sure that you'd gotten to a point where you had herd immunity. That's about 65% of the population all being vaccinated.
But that goal appears quite elusive, doesn't it, for South Africa and many other countries on the continent when you look at just where we are with uptake of these shots a year into many of the vaccination campaigns?
It does. And that's why we still need to practice the safety precautions and maintain them as though we were now at the beginning of the pandemic. Because for us, vaccine hesitancy is a big problem. You need to have to educate people, convince them to take the vaccines, even when the vaccines are available. And remember, it just takes one person to spread it to almost everybody. And the fact that you've been vaccinated does not mean that you won't get infected. It just reduces your risk of infection and the risk of complications and death from the COVID-19 virus. And so people are still at risk of vaccination. We're having people just taking one shot of the vaccine, and now the challenge is convincing people to go for the booster because they believe that they've had enough. And so we just need to try and play it safe as though we're not too sure where we are, but coming out so confidently could lead to very serious health implications and even financial and economic implications, the very ones that we are trying to keep under check.
How does South Africa compare, I wonder, at this point with the rest of Africa? Because I know we have the highest caseload, the highest death toll on the continent, but overall at this point in terms of both the epidemiological picture and indeed the response to managing COVID?
Well, that's why it comes as a surprise to us that South Africa is taking such bold measures, because they seem to have been more affected by other countries. And so we, the other countries who were not that affected, who had lower infections and lower numbers of deaths and higher recoveries, should have been the ones who are bold enough to take these steps, because we can confidently say that most people are not getting infected. But then their belief, South Africa's belief, is that because most people have been infected, they believe that the people have received immunity. And so they are at a point where they can state that they can go without some of the restrictions. It's a bit challenging from my personal point of view. And I think that it should be threaded with caution, because you can't be too sure.
Okay.
Yeah.
Dr. Hannah Tetteh, good to have your time as always. Thank you very much.